Welcome to the Movement PT Coffee Cast, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee-infused conversations.
All right. You ready, bro?
Are we live?
We're live. What's going on, guys? Welcome back to the Movement PT Coffee Cast. My name's Dalton, and with me, as always, is my beautifully bearded friend, William. William, how are we doing today?
I'm doing not too bad at all, man. How about you?
I'm good, bro. I'm glad to hear that you're doing well.
I'm like 7 out of 10. I'm like 7 out of 10 doing good. You know?
7 out of 10. Yeah.
Yeah, I'm hoping by the end of this, maybe get up to 8.5.
Yeah. That's a good goal to have. I'm probably sitting at like 7.3 out of 10. Good.
Oh, you just had to be a little bit better than me.
I had to, bro. I had to one up you.
Maybe that just means I'll have more improvement.
Yeah, exactly. That's what we're looking for, right? Guys, what's up? It's been a while since me and Will have done a podcast together, so we're excited to bring you this episode. Before we get into it, bro, I gotta say, congrats on pulling 500 pounds, dude. That's
thanks, man. Yeah, appreciate it. That was it's definitely heavy. I didn't think I would ever do that, so yeah, it's pretty awesome.
That's a big accomplishment, man. I can't even it's hard. I think it's hard for people to actually fathom like how much that is, dude. Like that's a lot of weight.
I don't even know if I fathom it, to be honest.
Because like I think about first off, I don't pull anywhere near that. But like I think about doing like some tough sets for me into like the low 300s, and I'm like feeling like I'm gonna die. Like I couldn't imagine pulling 500 pounds. How did you feel when you did that? Did you feel like an absolute animal?
I felt awesome.
Yeah,
I'm not gonna lie. Because it was just like, I don't know, whenever you get to like a new plate,
yeah,
a new plate on the bar, it just feels great because, I don't know, it's like you've entered a new realm. Yeah.
All right, before we dive any deeper into the episode, guys, I'm going to read a review because we are sharing people's reviews who leave us a 5-star. If you leave any less than a 5-star, we're not sharing that. But this week's review is from DV. He gave us a 5-star review. He said, "This is an engaging podcast featuring two energetic hosts interacting with thought-provoking guests on the topics of health and PT. I'm not in the PT field and was worried this stuff might not apply to me. I was wrong. This is not just for those in the PT industry. Topics are widely applicable to anyone interested in health, wellness, and human growth. I highly recommend the podcast for anyone who wants to expand their thinking on those topics." DV, man, thank you. We appreciate the love. It's kind of cool, though. I think this is a good one because it's kind of cool that it's like someone outside of PT field that's like taking away some valuable thoughts from the stuff that we talk about. So it's pretty cool.
Yeah, that's awesome. I love hearing that. Thank you.
Yeah, man. So if you guys want to have your reviews read, head over to iTunes, subscribe to the PT Coffee Cast, drop us a 5-star review, leave us a little comment, and we're going to read one review on each of our interview episodes. I mean, today we're not interviewing anyone, but this is going to count as our interview episode. So there we go. All right, Will, take us home, bro. What are we talking about today?
I think we're just going to kind of go over like a couple of cases that we both had that we kind of identified as like challenging sort of scenarios, and then just kind of like talk about them and talk about like maybe a little more detail, sort of like this, sort of like that. So like, am I starting? If I'm starting?
Yeah, let's have you start. Just to preface it, like I think this is a good. Me and you do this often, like off the podcast, where we talk a lot about certain scenarios that we've gone through, and me and you find it very helpful. So I think it's kind of cool for us to record one of those conversations, and just have our thoughts on the topic, but also can have other people hopefully chime in if they listen to the episode and let us know what they think about what we're talking about. So
yeah, 'cause we're sort of hoping like the conversations can just like spark some ideas and stuff for people, because like a lot of the things we talk about, we realize like they sort of come up often, like not maybe like exactly the same, but very similar. And so if you have some kind of like just thoughts brewing in your head beforehand, you can kind of like maybe feel a little bit more confident with approaching those scenarios. So it's kind of like what we're hoping from just kind of like sharing our just discourse about these kind of cases.
Yeah, for sure. So why don't you kick it off and talk about the one that you experienced recently?
Sure. So I had a guy who was like, pretty young, like maybe in his mid 30s. And he had just gotten back from a trip to Algonquin, which, if you're not from Canada, is like a provincial park that's well known for like doing like backcountry kind of hiking and stuff like that. So he was hiking and developed some knee pain over the course of the trip. And then he came back. It sort of settled down, but this is when he came to me, because he was explaining that although the symptoms have improved, he's worried because in a week and a half, he's going to another trip called the West Coast Trail, which is like I think it's like a 5-day backcountry hiking excursion. And so he's worried that he's not going to be able to enjoy the trip because of the impending doom from his knee, so to speak.
Yeah, that does sound impending. That hike sounds like impending doom.
So this is when he came to me. So I'm kind of presented with this situation where I know. So I guess I don't know if I've actually said that he had. It seemed like a kind of like a patellar tendinopathy sort of thing. So knowing a little bit about that, at least, am aware that probably a week and a half is not enough time to really get a solid enough adaptation within the tendon or within this person's body to have a sustained effect,
right?
Where we could get him to a point where he's unlikely to experience symptoms on the trip. I would say there's probably a high probability that he'll experience some symptoms. So that's where it's difficult, because you have to approach the expectations of them for what we can accomplish in the next week and a half.
Yeah, that's definitely a challenging situation, because it's got you in a couple of different spots, right? Like he doesn't have a lot of time till he leaves. So that's one thing. Two, like by the sounds of it, he's going on this trip regardless. So you kind of want to educate him in a way, and then you kind of mentioned before when we were talking, like no SIBOing him, right? Because you don't want that to happen.
Exactly. I don't want to set the expectation that he's going to have pain. Like maybe he won't.
Yeah, it's hard to really tell.
So you want to like try to avoid a self-fulfilling prophecy,
right?
Where it's like, okay, you're going to have pain. Like I'm not trying to predict his own pain.
Yeah.
But at the same time, like I can't have those expectations to be too high, because that's just setting myself and him up for failure. And then neither of us are going to be happy.
Yeah. What was his kind of vibes with it? Like, what was his head at with in terms of like what he wanted from you, or with like his pain? Like, what was he thinking?
I think that was the key, was that I had the understanding to ask that almost immediately.
Yeah.
I feel like if I didn't ask that would have been a tricky situation. So that's the key, is I asked almost right away. what are you hoping to get out of this? There's only a week and a half for us to make any sort of, develop any sort of plan. So I got that sense from him. And what he kind of said was, I want to know if one, like I'm going to make myself way worse, like really damage myself. And two, if I can get some strategies to kind of like mitigate it so I can hopefully enjoy the trip.
Right. I mean, that's pretty solid that like that's where his head was at with it. I feel like that sets it up for you a little bit better than him, being on the other side of things, like expecting you to fix him within a week and a half,
Yeah, totally. But at the same time, that does happen sometimes.
Well, for sure.
I'm curious from you if that did happen. So if the guy came in and he was like,
yeah,
I'm hoping you can fix me before I go on my trip. What's your kind of like thought process, and how do you maybe try to tackle that?
Yeah, that's a tough one, but I think you got to be straight up with someone at that point and just be like, obviously you're not going to be harsh about it, but you're going to find a way to come across like, realistically based off of like what we know, like physiologically and having adaptations and changes, like here's what you have going on, but realistically we're not going to be able to fix or take away this pain in a week. But what we can do is, come up with what he said, like come up with strategies for you while you're on the hike to minimize it. You can educate him around what like patellar tendinopathy is. That way he's not having thoughts of making himself worse or like being fearful around things. And honestly, like with someone like that, I would talk about like temporary pain relief strategies that he could use. Like for example, like some tape, like, or like some Voltaren, bro, or something, like anything that can, with the right like narrative around it. But if he's dead set on going, right, and he wants to have the most enjoyable, experience, like if you can give him some pain modulation, like if it's going to be like a little bit of tape that he could do on himself that he finds is helping, if it is something like a topical cream that could help him, decrease a little bit of discomfort, like obviously explain to him like this isn't going to fix you, this isn't going to make your knee pain go away, but if it can help you manage it while you get on your trip until you get back, and then we could actually take a real like approach at this, then this could be a option, for you.
Yeah, it's interesting. That's kind of the route I went, actually. Did the tape thing, showed him how he could do it, see if that helps. A couple other things I also did was like I showed him how to just preemptively, because it's a bit tough because it wasn't that symptomatic. It's hard to tell what he responds well to.
Mm-hmm.
But just kind of put all the tools possible in his toolbox and showed him how to do isometrics. And I showed him how to do them at different joints, just in case his like knee's not feeling it. He could try doing like hip isometrics or something. In case he is one of those people where it does kind of help.
Mm-hmm.
And then I sort of showed him like, okay, this is how you can be more hip dominant.
Yeah, I was just going to say, yeah, that's good.
And tendons tend to like slow movement.
Mm-hmm.
So whenever possible, try to do things slowly. So like if you're going down a hill, don't go fast down the hill. Go slow.
Yeah.
Like things, they sound goofy, but like it's these little things where maybe you think about them when you're on a trip and it just helps you get by. So it's kind of my process.
No, I think that's a good idea. I think I would have done roughly the same thing. I probably would have saw it too. I mean, I'm sure you did this, but like what movements may have caused like more irritation or aggravation, and then show him some, maybe demonstrate or show him some movements that he could come across, let's say on his hike, that would put him into these aggravating positions, and how he could maybe use another movement option to not put himself into that position, like you're saying, like be more hip dominant, trying to give him strategies of like stepping up or stepping down where the knee's not, if let's say the knee was going anteriorly and it aggravated him more that way, like how could you show him a way to step down where his shin's more vertical, if that feels better, like just like some things along those lines I think would be
right. And if there's a bear, throw it all out the window.
Yeah, bro. Well, he probably wouldn't have any pain then, man. He'd be good. Fight or flight, bro.
But yeah, one thing I wanted to kind of ask you about your thoughts on this, because I'm sure other people feel the same way, and I don't think it's like I know in my head I shouldn't feel this way, but you do for some reason. Like after this kind of session, like I'm not sure, I'm not that confident this person is going to come back to me after the trip.
Mm-hmm.
And so I feel like I didn't do a very good job. I'm just wondering like what your thoughts are on that, why do we feel this way?
Yeah, it's a good question. It's funny. I kind of little preemptive espresso cast, but like I talked about this on espresso cast I just recorded. It's going to drop this week, up after this drops, but not to spoil it, but we'll talk. I'll give you my thoughts on it. No, I think for me from that point of view is I think the expectations of people coming to physio sometimes is more of that fixing mindset rather than a coach or an education or a facilitator mindset. So I think where I feel is like sometimes I don't know, but you got their expectations, but sometimes you think like you need to do all of these things for someone or you need to give them all of these exercises. And we tend not to value a session like that where it's educational, where you're breaking down like movements, giving him tips, like going through all of those things. So when you do that and you get done with it, you're kind of like, is that what they wanted? This, at least from my perspective, like, is that what they wanted? Is that going to intrigue them to come back? Or are they just going to be like, this guy just talked to me. He didn't ultrasound my knee and he didn't, do soft tissue release on my knee to make me feel better. So I could see how you would feel that way. But I think personally, to be honest, like one is like, what else do you do? Like knowing what yourself, how you treat, what is going to be in the long run best for someone. Like, what else do you do other than what you did? Nothing, right? Like you're kind of handcuffed in that situation. My thought is if you if you do that whole session, you take the time to break it down and try to give him strategies to make his trip most enjoyable. And then he goes out and implements some of those strategies and actually gets some benefits from it. You know what I mean? Like he feels better. He's able to get through it. He's able to manage it. I guarantee you when that guy gets back from his trip, he's going to come back and be like, hey, what you told me worked. Like, how do I do more? You know what I mean? So I think it's like, it's almost something we bring upon ourselves a lot. Like it's almost like, I don't know the right word.
We feel responsible.
Yeah, but like it's almost something we put on ourselves, or like we're perceiving it more than how they're actually taking it. Like that guy could walk away from that session and actually have gotten extreme value, but you don't really know that, entirely until you see what happens, right?
Right. And I guess we care to deliver a lot of value, and so
right.
Like we take that on ourselves, where we hope what we did was valuable. You don't necessarily get that confirmation.
Yeah, and you might never, and it's just like you just have to know if you went through all the process, you did what you did, you listened to him, you took in his thoughts, you communicate to him, you gave him like your best understanding of what and did all you could in that session, then what else can you do? It's on that person. Some people are gonna take that information and run with it and it's gonna work out and maybe they come back, or other people are gonna not take that information. They're gonna be like, I wanted this, this, and this. and I didn't get it, and I'm not going back.
Yeah.
But I mean, you asked what his expectations were. So like you that when he said like I want strategies in this, you're like, okay, let's go. Like we're game. I can do that for you. Whereas if he came at you with I want TENS and ultrasound and I want you to fix me, well then it's a different story, right? So then at least now you know where his head's at, and you're gonna probably try to tell him, you know, what the legitimate possibilities are, like with this scenario. You know, maybe you do give them some TENS and ultrasound with the right narratives around and be like, listen, this might give you some temporary relief, but this isn't going to be the thing that's going to necessarily help you, you know, get better or even help you on your trip. Do you want to hear what might be a better option for you? And then if he says, Will, hit me with it, then you drop it on him. And if he goes, no, bro, I just want the TENS, you sell him a TENS machine. No, I'm just kidding.
No, but I think that's like, if there's any takeaway, it's like if you're someone who's out there and you're not overtly asking what people's expectations are, definitely start doing it, because that really helps you understand more where that person's coming from. And that could also be like just asking someone what their previous experiences are with like physio or chiro. But
that's definitely something I always ask. I always ask.
And I find every time I forget, I kind of regret it.
Yeah. No, and I've been there, and like we're talking about it this way because we've made the mistakes many of times already before in the situation. And it still happens. Like sometimes you still just lose that sometimes, and then sometimes you have to backtrack, and you can kind of pull yourself out of it. And sometimes you're like, damn, I lost that one. You know?
But you had a pretty good case that you're talking about earlier, so I'd be curious. Why don't you present that?
Why don't you present me with this case?
Put it on a platter for us.
Yeah. So mine, the one that something that I've been, you know, working through and I would say struggling with, I guess, and having a hard time, is I'm working with someone with a concussion, and we've been working together a little over a month now, and I guess right off the bat, like concussion is not something that I'm super confident in. Let's say like treating, you know, it's something that we touch on briefly in school. I've obviously like, as I've gotten some on my caseload, I've started to like do some research and look into like what's going to help, and we've talked to, let's say, shout out Molly Parker, like someone on concussion, like you know, learning some of that information and how to treat it. But the one thing that I'm really struggling with, or was struggling with this person, was having them be very hyper focused on the only thing that they see themselves as like improving is like having no symptoms. So they want their symptoms to be gone like right away. And if they don't see, if those symptoms are still there, they're not seeing their sessions or their time as successful, you know, which I think is a common thing that happens with a lot of different people with different injuries. I think concussion makes it really hard because sometimes it's hard to grasp like why some of these things are happening, because the symptoms are kind of like, you know, like dizziness and lightheadedness and different things like that. It's a little different than someone who just has like your typical knee pain. So I've been trying every session, you know, I think off the bat, I think looking back on it now as we talk about it, like maybe off the bat, like in the initial assessment or in earlier sessions, I should have maybe done a better job of laying that expectation out. Like I can't really remember, but I might have not done as good of a job of talking about like the timeline maybe of concussion, you know, the symptoms, and that the fact that like completely eliminating symptoms is not like our goal, and you might still be experiencing these things as we progress through our sessions. So like I probably could have maybe done a better job of that. But what I've always tried to do in each session is like reinforce, you know, improvements that he's had over the time of our care without like his symptoms being completely gone, because he still has it. But I don't know if it's maybe me not communicating in the best way, or if he's just having a hard time understanding it. Because like he'll come back and be like, I was able to do this exercise that you gave me, and my symptoms, I was able to get through it, and my symptoms stayed at this level, in comparison to like 2-3 weeks ago when we did that exercise. He was barely able to get through it without having to stop because the symptoms were so high, right? Or he was able to, do like some work at home for X amount of time before he started noticing his symptoms jumping up to like an unsafe level that we like decided upon. You know what I mean? And those are definitely signs of improvement. And like I would take those and reinforce it in our session. Like, hey man, like listen, like I know, you're not completely symptom free, but look at what you're able to do. And he would acknowledge it, but then it would just be like we're back at square one like the next session, and it's hard for me to, I'm having a hard time having him realize like that he's making improvements. And I think it's affecting how he's doing, because he gets kind of into this state of like, I'm not getting better. Why am I not getting better? Like I should be better. And that can be reinforcing, like starting to drop down into like, I don't want to say hopelessness, but like starting to question like, am I ever going to get better, when he is making improvements? You know what I mean?
Oh yeah. And it's interesting because as you were kind of talking there, I was thinking about the idea of like, because you talked about how you're unsure if maybe you didn't lay down a great expectation at the start. But I think something like we have to try to remember is like, you could lay down a great expectation at the start, but we have to keep in mind a lot of the people that are coming in, especially like this individual, are struggling at that point in the assessment. And like that expectation could be laid out perfectly, but you're going to have to keep reinforcing it. Like that's not going to be something where like expectation laid out, perfection throughout the rest of the treatment plan. Right? It's going to be like you need to reinforce that with like them coming into the sessions. And I think that's difficult because you have to be paying attention to the detail, of this person's improvement. You can't just view them as binary, as having symptoms or not having symptoms. You have to know, okay, and so that you can provide them those examples like you did. And I think that's probably like doing a good job, like you're highlighting, yes, you have symptoms, but hey, last week you had symptoms with less activity. If you can provide those details, you're doing your job by providing them a more positive outlook, and they need to grab a hold of that. Like that's going to ultimately be where the effort and the team has to be cohesive there. I think that's all you can do. Like put forth your effort to continue to provide them more ways to like give more detailed explanations. You probably got to keep asking and stuff, but at some point they have to take that and ride with it.
Yeah, for sure. And it's definitely, I think there's a lot more going on with the situation too. Like some just different factors are playing into it, in terms of like very stressed out about insurance and like not being able to do his job, and like there's some other things that play into it all too. But
I think sorry to cut you off, but I do think like I notice whenever those kind of like factors are at play, it does get very quickly to this idea of like I've still got pain, because they're so frustrated. They don't want to like sit there and give a better explanation for what they're feeling, because they're just so stressed. I feel like that's a really difficult situation. It makes it hard to get success for sure. Those complicating like factors is not necessary.
All right, guys, that's all we got for this episode. We had a little bit of technical difficulties. The Wi-Fi cut out, and me and Will were unable to continue the rest of our coffee-infused conversation. However, we were getting close to the end of the topic, so it's probably better off that the Wi-Fi cut out, so you guys didn't have to listen to us rant anymore. But on the real, thank you for tuning in. We hope you enjoyed this episode. These episodes are kind of just us chatting about experiences that we've had throughout the week or in clinic, and we kind of just use it as a way to learn from each other, and hopefully you guys can take something away from it as well. If you have any thoughts on the topics of conversation, please hit us up. We'd love to hear from you. We're trying to learn and grow ourselves. You can hit us up in the DMs on Instagram, Facebook, and Twitter. We're at the MVMT-PTs. You can reach us at themovementpts@gmail.com. And if you like this podcast or you've liked any other episode that we've done, please head over to iTunes, subscribe, leave us a review, and share an episode with one other person. We'd really appreciate it. It helps our podcast grow, helps spread our message, and we want to continue to provide you guys with the best content possible. That's all we got for today, guys. We hope you enjoyed this episode. We'll see you again soon. Peace.